and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Let's get right into it today. Let's start with the latest vaccine numbers.
Okay, well, thank you very much for having me on the program. Well, as of yesterday, we have 215,729 persons 18 years and above who would have been vaccinated. This represents about 44.3% of our adult population. We also have 81,761 persons who would have been fully vaccinated. So this represents about 16.8% of our adult population. So we are getting there slowly, but we need more people, as I said before. A couple of things we want to do. We have quite a lot of first doses available across the country, so those persons who haven't gotten their vaccines as yet, who haven't started the process, we want them to come to one of our vaccination sites so that they can get their first dose vaccine. Right now we are giving the Sputnik V first dose. We are also giving Sinopharm first dose. So any one of those two vaccines, you can get them as your first dose vaccines. We also have, as I keep saying, a lot of people now who are due for their second dose vaccine. Many of them would have received their AstraZeneca vaccine early in the vaccination process, and we are asking them to come forward and get their second dose. As you know, persons who have been fully vaccinated, we have not seen them coming to the hospital. We have not seen them coming to the ICU. And we have not had a single COVID-19 death of persons who have been fully vaccinated. So I think this is an incentive to get people to come out and get their vaccinations. So I want to continue to urge people to do so.
Okay, Minister. Now, the ministry has seen a good response from the over 60 age group. Can you say if all nursing and senior citizen homes, especially in Region 4, have they had a high vaccination rate?
Well, what we have seen when we look at the age disaggregation is that persons 60 years and above, we would have had close to 72% of those persons receiving their first dose. But again, for you to get the full benefits of the vaccine, you have to come back and get your second dose. So while we are happy with the large numbers for first dose, I think this is one of the highest numbers you have anywhere in the region. We wouldn't get the full benefits unless people come back and get their second dose. And most of these persons would have gotten the AstraZeneca vaccine. So we have AstraZeneca vaccine to give as your second dose, so we're urging people to come and to do so. Pertaining to vaccination in nursing homes, we've had teams that went into the nursing homes earlier, and they would have given a lot of those persons their first dose vaccines. And we will look at when they're due for their second dose and go back and administer them as well. The team was there yesterday, and they went to different communities. They were there on Tuesday as well. And so far, they have not reported any outbreak of diarrheal diseases or waterborne diseases. So that's a good thing. And perhaps the prophylactic measures that they would have taken by distributing bleach and those sort of things might be working. We were able over the last 2 days to do about 300 vaccinations in the Pomeroon. So many persons came out to get their first dose vaccine. So that was quite a successful exercise. So when the team went into the Pomeroon, not only did they do the surveillance for waterborne diseases, but they were also able to do immunization. So I think that's a positive thing. We still have a lot of people in the Pomeroon, however, that we need to vaccinate. And again, we want to urge more people to come out and get the vaccines.
Minister, you said about 300 persons were able to get vaccinated. That's both first and second dose?
Yes.
Okay.
Yes. Well, these drive-throughs have proven to be quite successful because on each occasion we've had in excess of 1,000 persons coming to get vaccinated. So it seems like a popular thing to do. um, this weekend we are planning to have two drive-throughs in Region 4. One would be at uh, the tarmac or the parking lot at Lilindale, where the Movie Tongue Massey store is located. So we'll be working there from 9 in the morning until 4, and that would be on Saturday and Sunday. So we want to encourage people who are on the East Coast and who haven't gotten their vaccines as yet to come out and get their vaccines at this site. We'll also be doing another vaccination drive at the stadium, and so the persons on the East Bank would be able to utilize that. So we're looking at Saturday from 9 in the morning, and we'll go until 6 in the evening at the stadium, and we repeat the same thing on Sunday. So those persons who haven't gotten their vaccine and would like to come at the drive-through, you can do so. And normally, while we would say that it's a drive-through, there are also people who walk through. And so if there are persons who want to come and get their vaccines, we'll be able to give you your vaccine. So whether you walk or you drive, we'll make arrangements for you to get that vaccine. We are also partnering with a number of private sector companies, and so there might be additional incentives if you show up and get your vaccine. So I look forward to seeing those persons who haven't gotten their vaccine to come on Saturday or Sunday to get their vaccines at either one of these two sites.
Minister, I know the last two vaccines that were held in Region 4 at the National Stadium saw about 1,000 people coming out to get their vaccines. What number are we looking at for this weekend?
Well, I mean, if we get 1,000, we'll be happy with that. If we get more, certainly. So it's something that we are planning for. So hopefully we'll get at least from these two drive-throughs a minimum of 4,000 people on these 2 days. So let's see. Maybe we'll break the record. Maybe we'll get more. And I guess once we unveil some of the incentives that we'll be giving, maybe more people would come out.
Thank you so much for your time today, Minister. This has been DPI's COVID-19 update. For more information, visit our website, dpi.gov.gy, or our social media platforms.